Good afternoon, everybody. Welcome to our COVID-19 July 21st video update. I know it's been a while, but with the increase in positivity of COVID in our community, we thought that we would start up our video updates again and bring you information. And as always, you can look on the Nixel mass media portal to gather information. Look on our COVID website and any other media platforms that are out there where we distribute our information. So first I'd like to start out with some numbers from Guadalupe. Report date of July 20th, 2022. Total cumulative cases from Pasco Yaqui Tribal Health Services up in Guadalupe, Maricopa County, the state, and other sources up there. They've had 3,650 positive cases. And confirmed deaths for the Guadalupe area stands at 44. For the Tucson area, we've had an increase as well. This week alone, we had 74 positive cases in our community. 39% of the positive cases were government staff, 9% were casino staff, and 51% were community members. 45% or 46% of those cases live on the reservation. 54% of those cases live off. 69% of the cases were fully vaccinated and 34% were boosted. So we would highly encourage everybody to continue wearing your mask, sanitizing, and social distancing whenever possible. And please, if you have the opportunity to get vaccinated or get your booster, please do so. Even though there's an increase in cases, most people are having mild symptoms, signs and symptoms, and it's not affecting them so bad that they have to go to the hospital. So not all cases, but most cases are that way because they've been boosted or because they've had the original vaccine. So, and I apologize, I forgot to introduce myself. My name is Matus. I'm the Director for the Office of Emergency Management. And to my left here is our Deputy Director, Paul Mesa. And then to his left is Mrs. Larkins from the Pasco Yaqui Tribal Health Services Division. She is the director of the nursing department. And she has some more information, COVID-related information that she would like to share with you as well.
I do. Thank you, Chief. So as Chief said, we continue to see an uptick in our positive cases, both in the community and in our workforce. So we're encouraging everyone to continue to be resilient against COVID-19 and wear your mask. The mask is required in all government buildings. All of our employees and staff have to wear a mask still. So to protect yourself, please make sure you have a mask. If you need masks, you can definitely reach out to the nursing department or to Chief Matus and his staff at the Incident Command team, and we will get masks out back into the community if that's what's needed. We continue to have the vaccine pods. Again, the vaccines that everyone has been receiving doesn't necessarily mean that you're not going to get COVID. What it does is prevents hospitalizations, severe hospitalizations, like going into the ICU and being intubated. We have not seen many of those cases in the last 18 months here since the start of COVID, where we had all of those terrible cases and loss of life. We've rolled out the vaccine pods every Thursday since January 18th of last year. We have administered, the Health Services Division, with help and collaboration with other departments, have administered over close to 16,000 vaccines, mostly to tribal communities. And as most know, we had opened that up to the general public starting, I believe, maybe about a year ago. We opened that up to the general public. So the vaccines don't cost anything. We offer first, second doses, booster doses. We've now rolled out the 6-month to 5-year doses as well. And those again happen every Thursday from 2 to 5:30 at the new Health and Social Services building. No appointments necessary. You can walk in anytime during those hours and get your vaccine. Again, at least the nursing department, and I know the other departments as well, want to keep the communities as safe as possible. So CRT is still doing food boxes for COVID positive patients with the uptick of 74 cases last week. Most of those cases are mild. Out of those 74, we can say possibly 2 had to enter the emergency room or seek emergency treatment. But we have had no loss of life, and that is very important. So the vaccines are working. So if you're still on the edge about getting your vaccine and have questions, you can definitely reach out to the nursing department or to Dr. Renteria. We'd be happy to answer any of your questions. Otherwise, I think that's it on the nursing standpoint.
Thank you.
You're
Appreciate
welcome.
that. Mr. Mesa.
Awesome. Well, thank you, Ms. Larkins,
You're
for sharing
welcome.
that information, all good information regarding the COVID environment and all the efforts and activities that we're collectively working towards achieving. So we wanted to transition to provide additional information. In addition to the COVID information, we wanted to touch base on some weather activity that we're anticipating beginning tomorrow, starting with an excessive heat warning that's been issued by the Tucson National Weather Service office. This excessive heat warning is for the Tucson metro area, western Pima County, and south central Pinal County. And that goes into effect from 11 a.m. tomorrow until 8 p.m. Mountain Standard Time. So with this heat warning, they're anticipating that we could see temperatures ranging from anywhere from 107 degrees to 114 degrees. So mostly those higher temps will be in the western portions of Pima County and our high desert areas. So again, we're encouraging anyone that is going to be active outdoors tomorrow to try to limit that outdoor activity to either early morning or late evening. Again, trying to avoid the hottest points of the day. With this heat warning, we are wanting to make sure that people are aware that heat stroke, heat exhaustion are primary hazards that come along with these high temperatures. And again, heat stroke, heat exhaustion are emergencies. If you start to feel any of those types of symptoms, make sure you seek shelter, seek medical assistance if need. After this heat wave, we're anticipating that we'll start to see a shift in the monsoonal pattern. We're anticipating that we'll start to see an increase in precipitation chances for the majority of the southern portion of the state, beginning as early as Sunday into the first half of next week. So while we've kind of had some monsoon activities here locally, it's been relatively hit and miss for most areas within the southern region. So hopefully we'll start to get some more rain. I know that with the rain comes potential hazards and issues, but just for the community, thankfully the facilities department is still providing sandbags. So if you are in need of sandbags, we recommend that you reach out to the facilities department to make those resource requests. Again, we are in the monsoon. We'll be in monsoon from June 15th through September 30th. So with that being said, Chief, that's all we have right now.
Well, thank you. Thank you, Mr. Mason. So everybody remember that famous saying, turn around, don't drown. Please, don't put yourself into a dangerous situation. It only takes a few inches of water to carry away your vehicle or your bicycle, or if you're on foot, walking through a flooded area. So please, turn around and don't drown. Keep yourself safe and keep everybody else safe. I'd like to make one other announcement on behalf of Tribal Council and all of our departments and the gaming enterprise. We do want to let everybody know that the plans are in the works for festivities for tribal recognition, which will be September 16th through the 18th, I believe, that whole weekend. So please just be on the lookout for additional information that will be distributed on the different types of events. Obviously, a lot of it, is dependent upon where we are at with COVID as well. So we ask everybody to please, be understanding and be flexible with whatever type of events may take place. Just because we don't know where this COVID pandemic is going to take us. So we just want to let you know that things will happen. For recognition, so please be on the lookout for additional information. And we thank all of us, thank you for tuning in, and we thank all our folks behind the scenes for helping us set this up. And we'll see you next time. Thank you. Bye-bye.
Thank you.